Bismillahirrahmanirrahim. Assalamu alaikum. So today we are going to study about the spermatic cord. So first, what is the spermatic cord? Now imagine the testes as a factory that produces sperm. Now the testes cannot function alone. It needs blood supply, venous drainage, lymphatic drainage, nerve supply and a duct to carry sperm. And all these structures travel together in one bundle, and that bundle is called the spermatic cord. So according to our definition, the spermatic cord is a bundle of structure that passes through the inguinal canal to and from the testes. Now, it begins at the deep inguinal ring that is lateral to the inferior epigastric artery. Okay, inferior epigastric artery is the artery that is supplying the abdominal layers, if you have taken the lecture of the abdominal layers. And then it ends at the testes. That means the spermatic cord is extending from the deep inguinal ring up to the testes. And here in the definition, two words are written that it says that passes through the inguinal canal to and from the testes. So the structures that are coming towards testes, that means, are the arteries and the nerves. While by the from we means the veins and the lymphatics that are going away from the testes. Okay. Now let's check at the location. So the location, the spermatic cord passes through the abdomen, then it passes through the deep inguinal ring, then through the deep inguinal ring it enters the inguinal canal, then it exits through the superficial inguinal ring, and then it reaches the scrotum, and then finally testes. So this is why many diseases of the abdomen can affect the testes, because testes are related to the abdomen via the course of inguinal canal. Okay. Now the structures of the spermatic cord, let's discuss them. So now let's understand every structure individually. First we have the vas deferens. Vas deferens is also called the ductus deferens. So actually what is it? So it is a thick muscular tube that transports sperm. Okay, now its function is it carries or it transports sperm. From where? It carries from epididymis, then to ejaculatory duct, and then from ejaculatory duct to urethra. Now I'm going to show this from a picture of Snell. Here, this is the epididymis that we were talking about. So basically this structure is called the epididymis. Now, it does not produce sperm. That means it is not producing sperm. Vas deferens is not involved in the production of sperm. It is simply involved in the transport of sperm from the epididymis to the urethra. Okay, and it features, let's look at some other features that are, it is thick walled, it is muscular, and it can be felt between the fingers in the upper scrotum. So that means we can palpate or we can feel this structure in the upper scrotum part, and it lies in the posterior part of the spermatic cord. Remember, where it lies in the posterior part of the spermatic cord. And about the feltness, so we can felt it in the upper part of the scrotum by palpating it between our finger and thumb. Okay. Now the next structure is about the testicular artery. So about the course of the testicular artery. So the testicular artery, it actually, after originating from the abdominal aorta, it descends on the posterior abdominal wall, and then it passes through the deep inguinal ring to enter the inguinal canal, and then it travels inside the spermatic cord to supply what structures? To supply the testes and the epididymis. That means the testicular artery is going to supply the testes and the epididymis. And remember the path, the aorta is giving a branch, that is the testicular artery, and that testicular artery is going to supply to the testes and epididymis. Let me show you the testes and the epididymis from the diagram of Snell's. So here, these are the testes. This structure inside the spermatic cord, this is what is the spermatic cord is actually, and these are the testes, and this is the epididymis. Here you can also see this is the testes and this structure is the epididymis. You can see the epididymis has further divided into three structures. One is the head, second is the body, and the third is the tail. So the epididymis is again divided into the head, body and tail. So this structure is the testes and this is the epididymis. Okay. Now let's come back. So now about the artery to the vas deferens, that is also called the deferential artery. So its origin is in the usually arises from the superior vesical artery. Artery to the vas deferens, that means it is going to supply the vas deferens or ductus deferens, this differential artery. and it arises from the superior vesical artery, and it supplies the vas deferens. Now about the fourth structure, that is the structure of the spermatic cord, or that is included in the content of the spermatic cord, are the testicular veins, or you can also say the Pampiniform plexus, because these veins are lot of veins. If you can see, there is only one testicular artery, but there are a lot of veins, and these veins are going to form a plexus that is called the Pampiniform plexus. Okay, now these veins form the Pampiniform plexus, and what are the function of these Pampiniform plexus or these testicular veins? So the first main function is, as their name suggests, is the venous drainage. They carries the deoxygenated blood from the testes. Okay, now about the cooling mechanism, so that is also a very important and a different function of the testicular veins, that they actually provide a cooling mechanism. So actually, what is the reason? So actually the venous blood is cooler than the arterial blood. Okay, and the Pampiniform plexus cools the incoming testicular artery. Okay, this testicular veins or Pampiniform plexus, it also cools the testicular artery, accompanying testicular artery by counter current heat exchange. Now the counter current heat exchange, this mechanism just works like the counter current multiplier mechanism in the nephrons, in the loop of Henle. This is just like that, this cooling mechanism. Okay, and then this keeps the testicular temperature about 2 to 3 degrees Celsius below body temperature, and that temperature is essentially for the sperm production. That means we have already studied in the previous lecture that the testes are actually during the embryonic life were originating in the abdomen, but why they can't stay in the abdomen and they descend into the scrotum? Because they required a 2 to 3 degrees Celsius below body temperature for the sperm production. Okay, now about the formation of the testicular vein. So how the testicular vein is formed? As you can see, these testicular veins, lot of testicular veins or Pampiniform plexus is actually going to form a single vein near the deep inguinal ring. So near the deep inguinal ring, the plexus joins to form a single testicular vein. Okay, and about the drainage, so the right testicular vein is going to drain into the inferior vena cava, and the left testicular vein is going to drain into the left renal vein. Remember, this is a very important Viva question, that right testicular vein is going to drain directly into the inferior vena cava, but the left testicular vein first drains into the left renal vein. Okay, now the fifth structure that is passing through this or that is included in the structures of the spermatic cord are the lymphatic vessels. Okay, now about the lymphatic vessels, these lymph vessels drain lymph from the testes, not from the scrotal skin. That means scrotal skin is excluded from here. Okay, so from the testes they are going to actually drain into the lumbar, or you can say the para-aortic lymph nodes, and they actually accompany these lymph vessels. They actually accompany the testicular vessels or testicular artery, and they are going to drain into the lumbar or para-aortic lymph nodes in the abdominal area at the level of L1 vertebra. Okay. Now there is a very important Viva point here, that if the testes are going to drain into the para-aortic or lumbar lymph nodes, then the scrotal skin, from where the scrotal skin lymph drainage is going to drain, so actually the scrotal skin is going to drain into the superficial inguinal lymph nodes. Now why is the difference here? Because the reason is this, that the testis develops in the abdomen. We remember the testis develops in the abdomen, so it retains the abdominal lymphatic drainage even after descending into the scrotum. Okay, now the sixth structure that is going to pass through the spermatic cord are the autonomic nerves, and these autonomic nerves actually accompany the testicular artery. Okay, and they arise from the renal plexus and the aortic sympathetic plexus. Okay, the renal plexus and the aortic sympathetic plexus are actually going to give rise to the autonomic nerves of the testes or spermatic cord, and they are going to supply the blood vessels and the testes. And remember, the afferent sensory fibers or the afferent sensory autonomic nerves accompany the efferent sympathetic fibers in the spermatic cord. So that means afferent and efferent are accompanying each other. Now, then about the next seventh structure, that is the content of the spermatic cord, is the genital branch of the genitofemoral nerve. Now, if you have taken my previous lectures, then you should have remembered that I mentioned the name about the genitofemoral nerve in a clinical discussion. Okay, so here we are discussing it again, the genitofemoral nerve. And remember, the genitofemoral nerve is not an autonomic nerve, it is somatic nerve, and it supplies what? It supplies the cremaster muscle, and it is responsible for the motor limb of the cremasteric reflex. Cremaster muscle, if you remember, it is the covering of the spermatic cord including the cremastric fascia and the cremastric fascia and the cremaster muscle. It actually arises from the internal oblique aponeurosis. If you have taken the previous lecture, you will know this point. If you haven't taken, I will again suggest to you, I will again appeal to you that please take the lecture of the inguinal canal development and inguinal canal before this lecture or right after this lecture, because otherwise you are not going to understand what I'm studying or telling you here. Okay. Now about the eighth process that is finally going to pass into the structures of the spermatic cord are the remnants of the processus vaginalis. Now the processus vaginalis, what is the processus vaginalis? We have already studied this in very detail in the previous lecture of the inguinal canal development, that the processus vaginalis is actually an embryological outpouching of the peritoneum, and they are actually going in the embryological life, they are going to guide the testes to, for descending into the scrotum. Okay, but after embryological life, or after you can say after the baby has born, these processus vaginalis, it actually obliterates, but some part or its small remnant still remains in the spermatic cord, and that is called the tunica vaginalis. Now I am going to show you the tunica vaginalis via a diagram of the Snell's. Here in this diagram you can see the tunica vaginalis, this blue structure here inside the spermatic cord. This is actually this is actually the tunica vaginalis. Okay. Here is the point that I mentioned about the lymphatic drainage of the testes and the scrotal skin is shown here, that the testes, they are going to drain into the lumbar or para-aortic lymph nodes at the level of L1 vertebra. Okay, and the scrotal skin, they are going to drain into the scrotal skin. This is the scrotal skin. They are going to drain into the superficial inguinal lymph nodes. Okay, and the reason is that the testes actually develop in the abdomen, so they retain the abdominal lymphatic drainage. Okay, now let's move towards the coverings of the spermatic cord or spermatic fascia that are actually very important. But if you have taken all my lectures in the order, then you are surely up till now pro with these things, the coverings of the spermatic cord, because we have studied the coverings of the spermatic cord separately when we were studying each muscle. Okay, now about the coverings of the spermatic cord, as the testes descend through the abdominal wall, it picks up three coverings. Okay, from the muscle from where they pass, they actually pierce their fibers and they form the coverings around it. The spermatic cord forms a covering around it, and these coverings are going to form the fascia. Now the first is the external spermatic fascia. External spermatic fascia is derived from the external oblique aponeurosis. Okay. Then the second covering is the cremastric fascia, and the cremastric muscle, we already mentioned that it is derived from the internal oblique muscles, and you can remember only the lowest internal oblique muscles contribute muscle fibers. Only internal oblique contributes करता है muscle fibers को. Okay. The cremastric fascia and the cremastric, this was about the cremastric muscle. This is the second covering. Now so the final covering is from the internal is formed from the transversalis fascia, that is going to form the internal spermatic fascia. Now why doesn't the transversus abdominis contributes a covering to the spermatic cord? So the answer is because its lower fibers arch over the deep inguinal ring. I also mentioned the same point, and I also showed you the diagram from the Snell's in the previous lecture about the inguinal canal development. Here I am mentioning it again because the lower fibers arch over the deep inguinal ring, and so they actually do not take any part in the formation of the coverings of the spermatic cord. Okay. Now if we learn an easy mnemonic for the coverings, that is EIT. EIT. E, external oblique fascia, external oblique aponeurosis is going to form the external spermatic fascia. EIT. I, we have the internal oblique is going to form the cremastric fascia and muscle. Then we have the T, that is the transversalis fascia, that is going to form the internal spermatic fascia. EIT, that is an easy mnemonic for remembering the coverings of the, you can see coverings of the spermatic cord. Okay. Now let's study a clinical condition or clinical note that is related to this, and that is vasectomy. So actually what is vasectomy? Vasectomy is a surgical procedure for male sterilization, or you can say to produce male infertility, to produce a male, to form or you can say produce male infertile. That is a process for the male sterilization, okay, or to produce male infertility. Now what is the procedure? So actually a small incision is made in the upper scrotum and the vas deferens is identified and cut and then tied. So first we cut the vas deferens, then we tie the vas deferens. Okay. Now what happens, what is the result of this? Okay, that now the sperm cannot no longer enter the semen, and the secretions from the seminal vesicles and the prostate are still produced. Okay, the secretions from the seminal vesicles and the prostate are still producing, but they cannot be transferred. The spermatozoa are now unable to transfer, and that produces the male sterilization or male infertility. Okay, therefore ejaculation is still going to occur, but the semen contains no sperm after the existing stored sperm are cleared, because because in the first few post-operative ejaculations, you can say there are still some sperms are present or spermatozoa are present, but that process is just for simpling and emptying process. That means we are just emptying what is left behind, and after that male sterilization or infertility is completely achieved. Okay, now let's revise some UHS Viva rapid fire questions. Okay, so define the spermatic cord. What is the definition of the spermatic cord? A bundle of structures passing through the inguinal canal to and from the testis. The two are we have the arteries and nerves, and from are the veins and the lymphatic vessels. And now where does it begin? It begins from the deep inguinal link lateral to the inferior epigastric artery. It ends at the testes. Now the coverings are the external spermatic fascia, cremasteric fascia and muscle, and internal spermatic fascia. Their origins are the external oblique aponeurosis, internal oblique, transversalis fascia. And which muscle is not contributing in any covering is the transversus abdominis, is not going to contributing in any covering. What is the origin of the testicular artery? So the origin of testicular artery is the abdominal aorta at the level of L2 vertebra. And the left testicular vein, what is the drainage of the left testicular vein? The left testicular vein is going to drain into the left renal vein, and the right testicular vein is going to drain directly into the inferior vena cava. And what is the lymph drainage of the testes? So the lymph drainage of the testes are the lumbar, or you can say para-aortic lymph nodes, and the lymph drainage of the scrotal skin are the superficial inguinal lymph nodes. And these points cover the definition, contents, coverings, lymphatic drainage, and fecal coagulation. So that was it. Thank you so much. Allah Hafiz.